Hi guys, welcome to another video. Today we'll be talking about HIV/AIDS. HIV/AIDS is a viral disease. We'll be talking about diseases caused by microorganisms. So HIV/AIDS is a viral disease, but we're taking it as a topic on its own to understand it better. So when we say HIV/AIDS, we're talking about two different acronyms or two different abbreviations. The first one is HIV, and HIV simply means human immunodeficiency virus. That is H for human, then I for immunodeficiency, then V for virus. So HIV is an acronym for human immunodeficiency virus. Then we also have AIDS, which is an acronym for acquired immune deficiency syndrome. A for acquired, I for immune, D for deficiency, and S for syndrome. Now, it's a disease in which the immune system of the body is completely broken down, thus rendering the body unable to fight the disease-causing microorganisms that attack it. Now, we've said HIV and we've said AIDS. So, actually, HIV is a virus. Then HIV, when it enters the body, it causes the disease, which is AIDS. So that's why we say HIV/AIDS. So HIV is the virus that causes the disease, which is AIDS. Now, when this AIDS enters into the immune system of the body, it breaks it down completely, and it renders the body immune system unable to fight disease-causing microorganisms that attack it. Now, the microorganisms that affect an organism after it has been affected by AIDS are called opportunistic infections, OI. We call them opportunistic infections, and they are diseases that are caused by taking advantage of a weakened or damaged immune system. So when AIDS enters the body and damages the immune system, we have some diseases or microorganisms that cause diseases which we call opportunistic infections. So these opportunistic infections take advantage of the damage that AIDS does to the immune system of the body. Now, AIDS is presently the most deadly of the sexually transmitted diseases. It's the most deadly sexually transmitted disease in the world. Now, what happens when a person is infected with HIV? Now, the body's defense or the immune cells are the white blood cells. Normally, that's what we all know, that the white blood cells are the body's defense, the body's soldiers that defend against infections or external attacks. They are the immune system or the immune cells. Now, the specific type of the white blood cells, the specific immune cells in the white blood cells are known as the T helper cells or the CD4 cells. Now, when an individual is infected with HIV, the virus enters the body and inhabits the white blood cells, where it multiplies primarily. So when the HIV enters into the body, it goes to the white blood cells, it inhabits it, and it multiplies in the white blood cells. So as the virus grows, it begins to attack these CD4 cells or T helper cells until they are so little in number that they are unable to fight infections. So this gives room for the opportunistic infections to attack the body. So that's what happens when someone is infected with HIV. The virus enters into the white blood cells, inhabits it, then it multiplies and attacks the CD4 cells, which are responsible for immunity in the body, and this causes the body to lose its immunity to fight against some opportunistic infections. These opportunistic infections begin to enter into the body. Now, how soon do people with HIV develop AIDS? How soon does HIV turn into AIDS? Now, in some individuals, symptoms of AIDS develop soon after infection with HIV. Then what happens is there's a decline immediately in the CD4 count and the presence of the opportunistic infections, which signals AIDS. But in some people, the development of AIDS or HIV becoming AIDS takes close to 10 to 12 years. So a person might not develop symptoms in 10 years or more. So in some others, it even takes longer time before these infections begin to show. But also that could also be dependent on the fact that if the person receives early medical care. So if someone receives early medical care, the symptoms may not quickly begin to show. The person might still have 10 to 15 years before symptoms begin to appear in the person infected with HIV. Now, what's the mode of transmission of HIV? How does HIV enter into the body? So when a person infected with HIV, what happens is that the virus enters into the body through fluids such as blood, semen, breast milk, and so on. And the virus can only be transmitted if these fluids enter into the bloodstream of another person. So when these fluids enter into the bloodstream of another person, the person can contract the virus. So the methods or the way this entry can happen, the way the virus can enter, the means it can enter through include, it can enter through the linings of the vagina, the rectum, the mouth, or the opening of the penis. So it enters through mostly the openings in the body, and it will enter through the intravenous injection. That's injection into the veins with a syringe. And it could enter into a break in the skin, such as a cut or a sore, an injury. So these openings that we mentioned that the HIV can get into, how exactly does it get in? It can get in through unprotected sex, sexual intercourse, whatever kind of, so whether it's vaginal, anal, or oral, with persons that are infected with HIV. Then also, a person can be infected by HIV by sharing needles or syringes with an infected person, an HIV infected person. Also, open mouth kissing with an HIV infected person is another way HIV is transmitted. Another way is by receiving blood transfusion from a person infected with HIV. Like we said, HIV is usually in the body fluid, so blood is obviously one of the body fluids. So HIV can get in through blood transfusion. If someone takes blood transfusion from an HIV infected person. Also, receiving a tissue transplant from a person infected with HIV, that's another way. Then infection during pregnancy, childbirth, or breastfeeding. So a mother can also transmit or give a child HIV through pregnancy or during the childbirth or even while breastfeeding the child. Also, contact with the body fluids of an infected person can lead to transmission of HIV. Now, what are the symptoms of HIV/AIDS? We've said that HIV/AIDS is actually, what actually happens is that it weakens the body immune system, which leads to opportunistic infections. So most of these symptoms are actually symptoms of other diseases that are caused by the opportunistic infections. And these symptoms include weight loss that's greater than 10%, fever longer than 1 month, chronic diarrhea longer than a month, persistent and severe fatigue. Then we also have persistent cough longer than 1 month, general skin irritation, swelling of the glands, and we have so many other symptoms. So those are symptoms of HIV/AIDS. How do we prevent HIV/AIDS? Many of the preventive methods are things you can already employ already, because since it's majorly a sexually transmitted disease, major way of preventing HIV/AIDS is total abstinence from all forms of irresponsible sexual behavior. So use of condoms, safe sex, and all of that. It is embedded in total abstinence from irresponsible sexual behavior. Then also avoid sharing sharp objects. That's another way. Then avoid blood transfusion from an HIV infected person. Avoid tissue transplant from an HIV infected person. And use sterile syringes and needles or new ones for injection. So we shouldn't make use of syringes or needles that have been used for other people, and we should make sure they are sterilized. So that's the way we can prevent HIV/AIDS. Now, how do we treat HIV/AIDS? Now, presently there is no cure for HIV/AIDS, but there is treatment. HIV/AIDS can be managed. what happens is that drugs are taken to help in combating the opportunistic infections, the OIs, and these drugs are taken in combination with the antiretroviral therapy drugs, call them highly active antiretroviral therapy, HAART. Now, if these drugs are taken properly, they are capable of reducing the amount of HIV in the bloodstream so that the immune system of the person can even bounce back and the person can have room to recover. And the immune system can return to almost a normal level and function properly. And the person can still survive for about 10, 15 years. Some people even survive for longer. Some people manage HIV/AIDS for 25 years and they still survive. So drugs are usually taken to treat HIV/AIDS. So that's where we can treat HIV/AIDS. So with that, we've come to the end of today's lesson on HIV/AIDS. See you in our next video.